What are the best exercises for drop foot? If you have drop foot, you may be worried about what caused it, how long it'll last, or if it even can be fixed. Plus, what exercises or other treatments are able to help it. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what drop foot is, what are some things that can cause it, if it can even be fixed, and what exercises and other treatments you can use to help fix it. So first of all, what is drop foot? Well, if you're watching this video, I'm guessing that you probably do know that in the first place, but just in case you were just browsing, a drop foot is when you're walking and your foot kind of slaps down on the floor, or you have trouble holding your toes up, and so you find you're dragging your toes or scuffing your feet, or potentially even tripping over your feet because you can't hold your toes up when you're walking. Now, the thing you really need to know about drop foot is that it's not just a muscle problem in your foot or in your lower leg. It's almost always, and probably just about always, caused by a neurological problem. Now, that can be a central nervous system problem, like if you've had a stroke or if you have multiple sclerosis, or it can be caused by a peripheral nerve problem, like if you have a pinched nerve in your lower back, specifically at the L4 or the L5 nerve roots. Those nerves innervate the tibialis anterior muscle, which is the main muscle that helps lift your foot up. Now, your toe extensors and another muscle called your peroneus tertius are also involved, but that tibialis anterior that runs on the outside of your shin, that's the main muscle that lifts your foot up and holds your foot up when you're walking so that you don't trip over your toes. So it is important, if you have a drop foot, to figure out what caused it in the first place. Because with a nerve injury, the longer that injury goes on, the worse the prognosis gets. And as to the question of can drop foot be cured, it really depends on the extent of the nerve injury and how long it's lasted. When someone has a stroke, they want you to go to the hospital right away, because the longer it takes before you can get the treatment, the more brain cell death there is. Just like if you have a pinched nerve in your lower back, the longer that nerve is pinched or compressed, the worse the outcome is going to be. So it is really important to figure out the issue that's causing the nerve problem and not just do exercises and stretches to get the muscle stronger, because the exercises and stretches that I'm going to show you in the rest of this video, they have very little chance of working if you still have a central nervous system disorder that's being untreated, or you have a peripheral nerve problem or a pinched nerve that's being untreated. So that's the first step in getting things better, is actually figuring out what the cause of the problem is in the first place and then addressing that. Now, if it is coming from a back problem, that nerve can be pinched for a variety of reasons. For example, a herniated disc or degenerative disc or spinal stenosis. And if you do have one of those problems, I'm going to refer you to my playlist of back pain and sciatica videos rather than try to address them all in this video. But make sure you address that central problem first. Now, as to the exercises that will help the muscle, when you're normally thinking about strengthening a muscle, you think about using weights or resistance bands, but in the case of drop foot, you have trouble even lifting the foot itself. So just lifting the weight of the foot against gravity is going to be enough resistance in the initial phases. And in some phases, if the muscle has gotten really, really weak, you may not even be able to lift your foot or lift your toes up against gravity. So to test and see how much muscle strength you have, you want to try to lift your foot and your toes up off the floor. And if you can do that, then you may be able to start doing some strengthening exercises. But if you can't even do that in the first place, you have to consider two other resistance mechanisms. One is gravity, pushing down on it. So if you can't lift against gravity, you want to first just make sure you can get some type of active movement or twitch. If you can't do it in a sitting up position where gravity is pushing down, you can lay down on your side and try and move your ankle And if you can get at least some movement or at least feel a contraction in the muscle that it's actually working, there's some signal getting from here down to there, meaning there's some prognosis for you getting better. If there's nothing, if you're just telling your muscle to work and nothing's happening whatsoever, I'm not going to say it can't happen, but the odds aren't very good at that point. But if you can see or feel at least some type of movement that's going on down there when you tell your foot to move, then you've got a chance to at least recover. So if you can't lift against gravity, just doing some active movement back and forth like that can be helpful. Now you have to also consider that stiffness in your calf muscles, the muscles that point your toes down that way, also resist you pulling your toes up. So if you have stiffness back here, it's going to make your muscles work even harder to overcome the stiffness of those muscles. So just stretching your foot by pulling your toes towards you like this. Pulling up, you can use a stretching strap like I'm using. You can also use a towel, and that works pretty well. And just pulling the toes up this way with your knee straight, and also kind of pulling with your knee bent to stretch one of your deeper calf muscles. And hold these stretches for about a minute. That'll help you lengthen your calf muscles so that you're not fighting as much resistance from your own body. Now, after you've done that, if you can get some active movement in your foot, but you can't lift it quite against gravity, you can use a resistance band. But in this case, the band isn't so much going to be a resistance band as an assistance band. In other words, you're going to use the band to actually help you lift your foot. And so to do that, you put the band on the ground, you pull some tension on it, pull your foot up kind of using the band, and then push down, and then use your muscles in your leg to help pull the foot up, and the band's kind of helping you along. Now, the tighter and the more tension you pull in that band, the more assistance it's going to provide you. The less tension you pull, the more your muscles have to work. And so as you get stronger, you actually want to put less tension on the band, meaning less assistance, until you're eventually doing it with just your own muscles. Now, once you've gotten your muscles strong enough to lift your foot up against gravity, then you can start doing some weight-bearing strengthening, because that's how you use your feet in everyday life. You use it to lift your foot up when you're going to take a step. You also use it to help balance. So to stand up and hold your balance, if you're standing like this, your tibialis anterior muscles, they prevent you from swaying backwards when you're standing up. So just practicing standing and balancing can be a good strengthening exercise. If you've had some weakness or some drop foot for a while, you're probably used to using AFOs or ankle foot orthoses, but doing some balance exercises without those orthoses is a good way to help strengthen your muscles. Now, I would stand in front of a counter or a couch or another sturdy object just in case you lose your balance, because if these muscles aren't working, you are more likely to fall backwards. Additionally, if you've got some weakness in those muscles, you may have some weakness in your calves or your other lower leg muscles that also help you with your balance. So make sure you're standing by something where you can hold on for safety purposes. Now, another weight-bearing strengthening exercise that you can do if you can lift your foot up against gravity is just kind of standing with your toes lifted and doing that. And again, stand by something where you can hold on for safety so that you don't fall backwards as you're lifting your toes up. But that's more of an advanced exercise. And then just being really conscientious when you are walking about lifting your toes up and hitting more on your heel so that you don't drag your toes and you don't potentially slip and fall. So those were the exercises for drop foot. And just to review, those were moving your foot in a non-weight bearing position, doing a calf stretch, with a stretching strap or a towel. Doing assisted ankle movement using a band. Doing ankle movement in a non-weight bearing position against gravity. Standing and balancing in a weight bearing position without any type of brace, but still holding on to something for safety. And then finally doing toe lifts in a weight bearing position where you're trying to lift your feet. And then practicing walking, lifting your toes, and hitting on your heels. So hopefully you did find these videos helpful. If you did, hit the like button and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.